Hello friends, let's discuss the so-called diabetes in a different perspective. Uh, the person who is diagnosed to have diabetes, if you ask him what you are having, he will say sugar ki bimari hai. So we as a doctor and the patient, both of us, society at large, refer diabetes as a disease of the glucose. Let me point you out a very important thing. If the definitely in every patient of diabetes, the glucose is raised. There is nothing to deny about it. But is it the cause or effect? Isn't it? Unfortunately, the diabetes is diagnosed in relation to blood glucose. It means diabetes simply implies that the glucose levels are high, right? So the glucose levels are high, but is it a cause of diabetes or the effect of diabetes? Let give me another disease for the sake of comparison, that is pneumonia. So the patient of pneumonia will have a fever. So should we diagnose pneumonia in relation to fever? Definitely not, right? Then we must be able to understand, we should understand whether glucose is a symptom or a cause, right? Is it simply as an effect or a cause of the illness, right? Then you all must be knowing, those who are attending to the doctors for a variety of reasons, and those who are trying to understand what it is, you must have heard a word called as insulin resistance. And to me, diabetes basically is, as you must be knowing, there is two varieties. I am talking about type 2 diabetes, and there is something called as insulin resistance, means there is an insulin which cannot act effectively. My opinion is that type 2 diabetes should be relabeled as hyperinsulinism, right? Because the insulin levels are high. If at all you ask any patient with a diabetes, what is the situation of insulin in the patient with a diabetes, he will definitely say the insulin levels are low. This is contrary to the scientific information that insulin, just remember everybody, right? The insulin levels are high in type 2 diabetes. The insulin levels are high, but the insulin which is higher in quantity cannot work effectively. So the effect is low, but the levels are high. So in type 2 diabetes, insulin is low or high, is definitely high, but it cannot work. So if at all we are treating glucose, the present concept understanding of diabetes is a disease of the glucose. So how treating the effect, that is glucose, will help? Definitely it will not. On the contrary, it will worsen the situation. So that's what I am saying. The hyperinsulinism, which is the cause of insulin resistance, should be treated, right? Unless we answer this problem of cause, that is hyperinsulinism, the treatment of the diabetes will be ineffective, insufficient, and unscientific. That is what is happening basically nowadays, since we are treating, focusing and treating the glucose as a symptom, because we are so much preoccupied by the concept of glucose, that we want to reduce it by any way or the other, usually with a drug, and we forget the cause, that is hyperinsulinism, that is totally neglected in the current day management of diabetes type 2. Thank you.